A breast augmentation can be done from the armpit, from an incision around the areola, from underneath the breast, or from the belly button. Many patients looking at breast augmentation dwell first on the incision, and what they dwell on is the scar. But each of these different incisions are really very different operations. They dissect through very different areas, they expose different anatomies, and they give very different results. Years ago, before it became clear that each of these incisions produce different results, I would just say to patients, where do you want the scar? And that would be the way that I would do it. But these journal articles that I was talking to you about in the earlier video, they very clearly show that the underneath incision is the best incision. Why is that? Well, for one, the leading cause of patients needing a revision operation is from the so-called capsular contracture. And capsular contracture is when you develop scar tissue around the implant. The implant gets hard and distorted. What we know now, it's the bacteria that live in the breast that get on the surface of the implant. Those bacteria then create inflammation, and that's what makes the breast hard. When you make the incision through the areola, you drag the implant through that bacteria and it gets on the surface. When studies compare how often people get hard from the nipple incision to, for instance, the underneath incision, it's very clear that there's a lower incidence of the hardening from the underneath incision. Time after time, study after study, bacteria of the breast on the implant has been implicated as the cause of capsular contracture. So that's a very strong reason why I recommend the underneath incision. Other reasons are that it's really the least visible scar. The armpit scar is visible if you wear a sundress or anything without an arm, without something covering your armpit. The nipple incision is seen straight on, and of course it's the focus of the most attention on the breast. And the belly button incision really only can be used for saline implants. It tends to be less accurate, more painful, so I'll push that to the side because it's not something that you frequently see patients that are even considering. The underneath incision also has a lower chance that the implant will be out of position. When you think about it, you want that implant exactly in the right place, and that underneath incision has the best chance the implant will be in the right place. Another thing to consider is a lot of patients after breast augmentation will have another operation in the future. And the underneath incision affords the surgeon in the future the best opportunity to fix any kind of problem that may have occurred, whereas the nipple, and more particularly the armpit incision, are very limiting in what kind of revisions you can use later. I'm willing to talk to you about any of the incisions, but I'm going to push you almost certainly to select the underneath incision because that's just what the data shows. Is the data perfect? No. The data does not absolutely say that that's always the best way to do it. But all the data that does exist makes a strong suggestion at the very least that this is the best way. If another surgeon tells you about the armpit or nipple incision, really challenge them. Challenge them to show you the published articles in good journals that show any advantage of that incision to the underneath incision. I've never seen such an article, and if you ever can trace one down, I'd be very curious to see it.